Hey, I'm Mark Testa. Thanks for joining me here today in this short video where we're going to talk about an orthopedic surgery avoidance health benefit for self-funded employers. Let's get started in this. So, musculoskeletal costs are the number two spend for most self-funded employers. This came out in the summer of 2022 from the Business Group on Health that showed this move from number one to number two, replaced by cancer. Nonetheless, it's a very high spend for most self-funded employers. And I did a little survey this year on LinkedIn asking who was using some sort of solution to address this. And actually, very few people are. Really, very few people are addressing this cost head on in any way. Some people use digital physical therapy. Other people, even fewer, use a surgical center of excellence to address these costs. But nonetheless, this is just hanging out there for, I'm going to guess, over 90% of employers that aren't really doing much to address it. And that's what I want to talk about today is a non-surgical approach to address this expensive cost for self-funded employers. Now, what is Regenexx? Regenexx is a medical specialty called interventional orthopedics. It's a needle-based approach to addressing arthritis and musculoskeletal injuries, ligament tears, tendon tears, things that people go get orthopedic surgeries for. It's a lot safer than the surgeries that are usually used to address these because we're using the patient's own cells from bone marrow concentrate, which contains stem cells, and from their blood in platelet-rich plasma, sometimes called PRP. You may have heard of these. Now, because this is needle-based and not a surgical intervention, it's a lot safer. People recover a lot quicker because they're left whole and intact. We're not putting in hardware. We're not taking anything out. We're just using their own cells to address their pain. Now, we have a national network of physicians literally around the country able to address any size self-funded employer. We are the world leaders in this research and development. We've been doing these procedures since 2005. We've got over 40 peer-reviewed papers listed on our website. We've got data that we're following with over 40,000 patients. So we're very confident in what we're talking about. We have the data, the research, and the safety, which we'll get into. And we're the only ones in this space with a national self-funded practice and the ability to address these kind of conditions. Now, where does Regenexx fit in the whole scheme of things? We fit in after conservative care therapies are no longer helpful for the employee. And that happens quite a bit. So after physical therapy, after medication use, after low dose steroid injections, after burning nerves, when those no longer work for people, we fit in right before elective orthopedic surgeries. And we feel confident that we can intervene on up to 70% of people who are headed towards a surgical intervention. Now, we're going to talk about our prior auth process and how we make sure that we are fitting in before elective orthopedic surgery and after non-surgical conservative therapies are no longer working. We want everyone to use the tools that are already built into the plan, use the physical therapy, use the pain management, use all of those tools before you use us. We'll talk more about that here moving forward. This is a real value for employees. Many employees continue to work because they're afraid they're going to lose their job if they're out of work for a long time. Many of them put it on the back burner because of costs that they know they're going to incur on this. Some people have had surgeries that they haven't had a good outcome from before, and so they're reluctant to do it again. And so this is a real value for employees. Now, for the employer, this is even better because there's no cost to add this to the health plan. There's no cost, there's no PEPM. You only pay as you use it. And so also for the employer, there's less downtime because it's needle based. Physical therapy and rehab is going to be a lot less. So employees aren't going to have to come and go from work frequently. So there's a lot of upside and in using this, and we can help reduce the need for, like I said, up to 70% of those elective orthopedic surgeries. We can treat literally everything from head to toe. Now, the main things that go to any sort of physician in musculoskeletal are no different than us. Number one, knees. So if somebody's trying to put off a knee replacement, or they've got a meniscus injury, or they've got degenerative knee conditions going on, this is something we treat very, very frequently. In fact, let me tell you about meniscus surgeries. Right now, multiple randomized control trials say these are not any more effective than fake surgery or physical therapy. In fact, Aetna is no longer paying for arthroscopic knee meniscectomies because they know it doesn't work. Medicare, CMS is soon to be doing the same thing, and some of the blues are making it very difficult to get a knee meniscus surgery because they know it just is ineffective. So we're going to see more and more of this happening. But then what else? Spine, right? All of us know somebody who's had a spine surgery that didn't do well. And frankly, there aren't many great surgeries for spine. Of all the conditions I took care of, surgical failures, the majority of them were spine. And so we can help all the disc related problems, spinal arthritis, spinal stenosis, facet syndrome. These are the joints in the spine that we can address. And of all the top two orthopedic surgeries I've seen ever pierce the stop loss, it's joint replacements and it's spine surgeries. And spine surgeries can be six figures with a lot of recidivism and a lot of missed work and just ongoing discomfort for people, sometimes leading to full disability. I've seen that happen in my career. The other top three surgeries we can intervene on are shoulders, rotator cuff tears, shoulder labrum tears, and we can use the patient's own cells to address these injuries, reducing the need for the lengthy rehab that goes along with a rotator cuff tear, sometimes up to a year, or shoulder labrums, 6 to 9 months of rehab to get it back fully. We can do this with a needle-based procedure. Now, we also address all these other things in the body: carpal tunnel, trigger finger, hip problems. If someone's on their way to a hip replacement, this could be a good alternative for them. Hip labrum tears, tennis elbow, golfer's elbow. We can get into the ankle ligaments, plantar fascia, bunions, Achilles tendons. You get the picture. We can address the entire body, head to toe. Now, I just want to share a little bit with you about our traction, because there's a lot of solutions out there that are doing a good job, but we work with over 600 self-funded employers, right? This is a big deal because you're not going to be the first. There's a lot of people already doing this. We've added 80 new employers as of 10/1/22 this year, and we work with employers in all 50 states. So we can help any employer of any size as long as they're self-funded. For 1/1, we had 100,000 new lives. So this has got a good head of steam. People are looking into this. They're doing this. They're moving forward with us on these. We work with dozens, 88 TPAs that will adjudicate our claims. We even work with the Blues and the Aetnas and the Cigna ASOs. So they will take care of paying for these claims. I hope you see some on this list. If you don't, let me know, because we literally add several a week to our list. We also work with over 70 stop loss providers who will mirror the plan amendment necessary to add Regenexx to the self-funded benefits plan. But the stop loss providers realize this is safe, and so they mirror that amendment without any problems. Also adding multiple stop loss providers on a weekly basis. So if you don't see one on here, just let me know. Now, interventional orthopedics, what we're doing is transforming musculoskeletal care. And let's get into the weeds about this a little bit. Wellmark on their website lists what they consider investigational and experimental. And Regenexx right now, with a fully insured plan, is considered investigational and experimental. But I want to use the Wellmark definitions here to address these literally point by point on safety, evidence, FDA, prevalence, meaning the ability to serve all your employees, and the standards of care. So let's take a quick look at this. We published the world's largest safety paper on bone marrow concentrate for orthopedic conditions. This is the third of its kind. It's not the first, it's the third, but ours is the world's largest, 2,372 patients, over 3,000 patient procedures performed. We had 4 adverse events. This is a very, very safe technique because we're using the patient's own cells. They're only out of their body for a couple hours, and then they're put right back in. Now, if you compare that to something that is covered by fully insured and self-funded employers, a knee replacement, close to 1 million of these done per year, there's a 6% serious adverse events that can occur in the first 3 months. That's a big deal. These can be multiple different things we're not going to get into right now. But when you want to compare apples to apples, this is very safe. It's the patient's own cells. Now, what about research? Let's see. We publish all of our research on our website. It's all there. They're peer reviewed. And so we've been doing this since 2005. You'll find all of our research available on our website. When we look at the world's research on bone marrow concentrate for orthopedics, we did this infographic. It goes to about June or July of 2019. I'm sure it's even more robust at this point. There are, at this point, 11,000, almost 500 patients that have had bone marrow concentrate that have been published in the peer-reviewed literature. And if you want this slide, I can share this with you because each one of those circles goes right to PubMed. You can read the research. All these yellow dots on here are our research. So the research goes back to 1997. It's very robust data that shows that this has been around for a while. And again, crossing the T, dotting the I on those definitions of investigational. We look at PRP, there's 24 or a couple dozen randomized control trials here just for knee osteoarthritis, the majority of them showing this to be effective and safe for addressing knee osteoarthritis, beating the standards of care. Synvisc injections, Hyaluronic medications, steroids, etc. Very safe. And let me explain this even a step further. In 2019, TRICARE, the insurance for the uniformed military and their families, 9 million covered lives, added PRP to their toolbox for knee osteoarthritis. Pretty impressive. They also added it for tennis elbow. Now, in June of 2022, American Academy of Orthopedic Surgeons did the same thing. They're saying PRP for knee osteoarthritis is more effective than what we're currently using. The Hyaluronic injections, the steroid injections, the non-steroidal anti-inflammatories. This is moving into mainstream medicine, and which is, again, making it easy for self-funded employers to say yes to this. Now, what does FDA say about this? FDA has very clear guidelines on using cellular-based medicines. We fall in between those two guidelines here in a 361 tissue designation. Very clear. This falls under the physician's practice of medicine, the physician's state license to practice medicine. Now, just to put it into contrast with something else, rotator cuff surgeries do not fall under FDA jurisdiction. This also falls under the physician's practice of medicine. So when we're comparing, again, apples to apples, this is the physician's practice of medicine. There are definitions on FDA website regarding these terms here. It turns into a drug and falls under FDA jurisdiction when you're doing certain things to the patient's cells, more than minimally manipulated. You're adding chemicals, or there's someone else's cells. So again, very clear guidelines here on the FDA website. This falls under the physician's practice of medicine, not under FDA, no different than orthopedic surgeries. Now, what about prevalence? We've got about 80 clinics or so currently throughout the United States. These are all musculoskeletal specialists. They already know how to use the ultrasound and the fluoroscopy to put the cells into the damaged and arthritic tissue. We're no more than a couple-hour drive for most employees to access a physician in our network. These doctors license our intellectual property. We don't own them. We don't run their practices. but they are part of our network. And so if someone's a little bit farther away than they'd like to drive, we've been doing telemedicine since 2010. So again, using the information we have from the world's largest registry on this, over 40,000 patients, we know exactly what we're looking for. We'll do a Zoom call with the patient. We'll look at their medical history. If they have imaging, we'll get their imaging, and then we'll let them know if they're a good, fair, poor candidate for Regenexx, and let them determine on whether they want to travel to the clinic for the treatment. We can also do the 6-week follow-up via telemedicine. Now, how do we control quality? We do this in multiple ways. Number one, by choosing the right physicians, right? We vet them. We make sure they have the skill sets. We make sure they can do the procedures. And so we've done all that work on the front end. We also have quality assurance and quality control monitoring led by a PhD researcher, really staying on top of what's going on, what we're putting back into the patient. And we monitor this on an ongoing basis. And then we're also outcome driven. We're also monitoring the outcomes of the procedures. Again, in that registry, we're tracking all that data. We're also tracking the data on the physicians. So we are doing high level due diligence to make sure that quality is maintained throughout our network. Now, what about cost savings? We've got multiple case studies, but I want to share this one from the Validation Institute. They looked at our data on a large employer, 77,000 life group throughout the United States. And let's look at that. We did 126 procedures on this group, costing roughly $925,000. Again, the majority of these were knees, spine, and upper extremity, largely shoulder, at that cost. The average cost for these was about $7,300. And then we compared those surgeries avoided to Healthcare Blue Book data. We like Healthcare Blue Book data because it's an all-in cost, meaning the facility, the anesthesia, and the professional fee. And the costs for these same 126 surgeries avoided, and I'm going to explain how we got to that in a minute, over $2.5 million. So extensive savings right there. Now, we know everything in medicine has a failure rate. We are no different than a failure in blood pressure medicine that didn't work the first time and they had to change the prescription, or an orthopedic surgery. The effects are a little more deleterious when the orthopedic surgery doesn't work. Now, let's look at the costs, knowing, again, our own data, and we know some of these people aren't going to respond to a Regenexx procedure. And so we added in the cost of the surgery to address the failures from our procedure, totaling roughly $446,000. Now, when you add that to our costs, it's roughly $1.5 million ballpark, 1.3. And then subtract that from the 2.6 million in orthopedic surgeries. It's again about a $1.3 million savings. In this case, it was a 49% cost savings, all in. Our costs, the failures, and they didn't happen. We're just adding those in, assuming that they will, because everything fails. Something fails in medicine. Now, everything's not 100%. But these cost savings were validated by the Validation Institute. I'm glad to share this report with you if you want to take a look at it in further depth. Now, we've talked about our failures. I've got a failure rate document. Again, I'll share with you. So we're totally transparent on this. We look at that data from our registry. And so glad to share this with you. We go through it by body part. Our failures are generally really low, certainly lower than many orthopedic surgeries. Now, prior authorization, I mentioned that. This is how we know what surgery is being avoided. That's how we're confident to share that with the Validation Institute. That's how we are able to go back at Healthcare Blue Book and look at what surgeries were avoided and tally up those costs. So we have a process where the physician, the treating physician in our network, needs to submit a documentation. This is peer-to-peer, so physician to physician, letting us know what conservative care was already attempted, or if the patient has already seen an orthopedic surgeon, been told they're a surgical candidate. So in order to get approved for a Regenexx procedure, those need to be done. That's our value proposition, in addition to the surgery avoidance to the employer. We are being careful with how we spend the money. We don't want to step over pennies to pick up dollars, right? So if you hurt your back raking the yard on Sunday and you call us on Monday and you had not tried physical therapy yet, we're going to recommend first that you go do physical therapy, right? That's the right thing to do. That's the right medicine to provide. And so we're making sure we're avoiding elective orthopedic surgery, that we're not avoiding conservative care that might address the problem. So let's get into how to add Regenexx to the benefits. I mentioned the summary plan description amendment. There is a 1 to 2 sentence plan amendment that needs to happen. It's a very easy process. We have this implementation and utilization guide that we'll share with the employer, with the advisor, with you, and with the TPA. And then it's very simple. It's very easy. We will walk people through all of this. We work with, like I said, over 80 TPAs, so they already know how to work with us, most of them. So we'll send that amendment to the TPA. We have a national fee schedule that we'll share. Again, our average cost in 2022 was $7,300. And then we'll work with you on and the employer on plan design. Now, a lot of employers want to waive co-pays and deductibles to incentivize this behavior. And if it's appropriate, if it's not a high deductible health plan, I would suggest that, because we want to get a look at people and see if we can help them avoid elective orthopedic surgery. Because if every Regenexx procedure performed is an orthopedic surgery avoided. So we want to help you with proper plan design here. Now, at no cost to the employer, just like this has got no PEPM to add to the plan, our utilization strategies have no cost to the employer as well. We will mail a benefit card with a one-pager that explains what this procedure is. And you saw that body part conditions treated slide early on in this process with that on the back side, letting employees know what we can help them with. Now, I do weekly educational campaigns, webinars, and so we want to invite as many employees to come and learn about this and make an educated decision. I go through the whole process, where we get the cells, how the cells work, what conditions we can treat, and then we talk about their benefits. And then the third thing we do, also at no cost, is targeted outreach. If we can get a file feed from the TPAs, independent TPAs are pretty easy to work with, but let me tell you what, so is Meritain and UMR. So sometimes they think that, the larger ones are more difficult to work with, and that's not the case. We have great relationships with them. We get the file feeds, and what we'll do is we'll email, we'll call, and we'll send a postcard. And our goal there is to just drive them to their employee portal. Every employer gets their own portal that explains more about the benefits. And our goal there is to have the employee come to a webinar and again, learn so they can make this decision for themselves. All of that, no cost to the employer. We can also work in a care continuum. So if you've got care coordination, navigation, we can work with them. We work with Quantums and others. And my favorite care coordinator, the OG of care coordination, is direct primary care. And we've got some great relationships with DPC. We train those physicians. We let them know about our UR process, our prior auth process, and then they make the appropriate referrals, whether they're on site. And I just did a training for 3 physicians that were on site for a large manufacturer, or they're near site, or they're telemedicine. We can train them. They can make appropriate referrals as well, and help people get to us when it's appropriate. I mentioned targeted outreach. Now, employees love this, right? A lot of people continue to work in pain because they're afraid they're going to lose their job. They're afraid they're going to miss too much time from work. They don't want to go on FMLA. 100 reasons, right? It's not convenient. They don't have time for missed work. They had surgery before, it didn't work. But this is what employees say. It's nice to have options, because look, when we can't move, everything throughout our biology gets worse. Our mental health gets worse because we're meant to move, and pain is a drag. Our weight gets worse. Again, for the same reasons, we're meant to move. Our diabetes gets worse, right? Medication use gets worse. Blood pressure gets worse. So, musculoskeletal care like this really fits into the entire plan. So, if you're focused on PBM and reducing costs, great. Let us help you with that. If you've got a diabetes strategy built into the plan, great. This also fits in as well with that. So, a full night's sleep, right? That also gets affected. And when you have bad sleep, it affects all of our biology from cardiovascular disease to dementia. What else? Improve physical and mental well being. We don't want to just throw medications at well being. We want to help people move and do things they enjoy doing again, getting back into their community. Worth trying before more invasive and costly procedure. And this one here, all the way on the right, it was determined that PT would be the best route to go. So again, we're delivering on our value prop. I want to offer this to you, a cost savings analysis. It's totally free. This is one I did for a large employer with employees all over the US. They gave us their amounts paid for these procedures. So we need CPT codes and costs. We used Healthcare Blue Book data and looked at the savings. We also used their data, but again, their data didn't have the all-in costs, right? Didn't have the facility, the anesthesia, and the professional fees. So we rely on more Healthcare Blue Book data. It's more accurate. Although we shared the cost savings, it was about 50% here, depending or more, depending on which number you look at. But you can see 1.8 million or 1.3 million. Nonetheless, this money stays in the employer's pocket, which they can use to pay their employees more. They can use to buy more equipment to run their business. You get the point, 100 different things. So this cost analysis is free. I need a CPT codes for the elective orthopedic surgeries and the costs paid. Now, if that's difficult to do, give me a call. I'll walk you through some other ideas. I'm available for questions to answer, go more in depth. Of course, we could go more in depth on all of this, and I'm glad to do that with you. I'm also glad to help you with conversations with employers. Or if you want to share this information with your entire agency, I'm glad to do this. And if your agency is self-funded, like a dozen others that we work with, they've added Regenexx to their own benefits. It makes sense to offer to their clients. It also makes sense for them to add to their own benefits. So if that's an option, I'm glad to have that conversation with you. So I really appreciate your time here today. Any questions? That's my contact info. Glad to run a cost savings analysis for you. I wish you all the best and thanks for listening. Bye-bye.